Immigrant families are oftentimes very invisible to everyone.
They're not necessarily being remembered by all of the cities or all of these organizations.
We're out in the community every day, Monday through Friday. You see our outreach staff out there talking to and just being with the day laborers and the immigrant families in our community.
We get to know them really well, and sometimes they will have questions for us or issues with people who hire them and then don't pay them, and they will ask us what to do, if we can help, which we can.
These men, they're looking for work on the street and they survive off of that, and it's not consistent. So you have to go where the community is. You can't expect them to take time from their very busy day because they're trying to survive. Every single week we do at least 2 workshops and we let them know about sugary drinks. And we provide water bottles and just alternatives. So everyone thinks, water's a little bit boring. So our job is to make it seem interesting and to make them understand the health issues and how our communities are more prone to these diseases and diabetes. And so it's just letting them know what's happening and to know that they have different choices.
Our mission is to accompany immigrant families in their transition, whether they're new arrivals or have been here for many years. We think of the family as a system, so we really do provide a holistic approach to our services. We offer wraparound services in just about anything. Services to the day laborers, so job placement assistance, but we also provide support to their families, so anything from GED courses to business entrepreneurship training, as well as legal and health support. Whether that be referrals or direct service, is really what we're all about. We also have youth programs and provide academic support.
Every day someone comes in and they're like, oh, I don't know how to sign up for healthcare. I don't know how to translate something on their phone or how to activate it, just the simple things. And I feel like this space and MI has provided that direct access.
We do have the language and cultural capacity to relate with these individuals, which makes us a very unique organization. We are immigrants ourselves, so having that connection to the people we serve has been very rewarding and very beneficial to the work that we're trying to provide. They trust us, they trust our staff, they trust our organization, and they know that we're offering them only good things.
It's important for marginalized communities to be served from within, because sometimes it's like, oh, these are for that community because they do this, without realizing, hey, these people are put in these situations where they have access to more sugary items, where they don't have access to healthy things. It's not like, oh, these brown and black communities prefer sugary drinks, this is what they do, this is their culture. No, they've been placed in these situations. And I feel like as long as that's addressed and the people that do this work realize that and they don't blame these communities for the situations they're put into, I feel like that's how we can grow together and make a change.
We've been in this city for 28 years now. Because we've been doing health support and health services for all these years, it was just a great fit. Receiving this additional funding has been great, and we've been very intentional about the purpose of Measure D.
Sugary drinks are an issue in our community. Berkeley is being quickly gentrified. The stores and resources that are available here aren't necessarily geared or available to the Latino and Black communities. And so it's easy to go to the corner store and have access to an energy drink or a soda to help you relax, because these are people that are working all day long. They're stressed, and a natural reaction is to get yourself a treat.
We provide services to the day labor community. We do some social media campaigns as well, on-site screenings and health services related to the negative risks of sugary sweet beverages. We also have been able to bring some organizations on-site. For example, we partner with On-Site Dental Foundation, who's a nonprofit that offers free dental services to the day labor community.
I supervise the after-school mentoring program, and so I have about 30, 40 kids coming in every single day from here in the Berkeley community. Often they would come in with treats. You know, of course it's after school, you want to relax, and your parents, you know, they get you a treat. Like a Powerade or a Gatorade or just even a Capri Sun. And you know, that's very natural. It's a go-to for students and for kids.
Do you guys know what sugar sweetening beverages are? Yeah. What would that? Can you give us an example, Toby? We're gonna do like juice and soda and stuff. Yeah.
When we have these conversations with these students, it's not just with the students, it's with their parents too. It's a community effort. Parents are welcome and they're there specifically for the workshops and to learn more about these things.
Sports drinks, sweetened tea or like coffee drinks are also included in sugar sweetened beverages.
It's really nice to see little kids and they're already like, I'm not gonna drink that soda because that's not good for me. Or like, oh, I went to a party, I went to a quinceañera this weekend and we were drinking soda, but I didn't want any, I just had water. And so, you know, it's cool to see them make that change. And the moms, they're there and they're listening and they're not packing that Capri Sun, they're not packing that sugary drink for their child for their school anymore.
Through Healthy Berkeley, it's been a very great cohort environment. So we do meet once a month to kind of share what each of our organizations are doing and come up with partnership ideas. It's been great to be connected to all these organizations that are working towards the Measure D outcomes.
It's very important if anyone's considering a soda tax in their own city to consider the smaller organizations or the grassroots organizations, because these organizations, they mirror the communities themselves. It's your neighbors talking to you, it's your family talking to you, and that way it's more subtle, it's a conversation. It's just, you know what, hey, these things are bad for us, and it's good because that's how news spreads in our community, by word of mouth and by listening to people that we trust. With time, it was normalized, and to see us walking around with our water bottles and for us to, you know, provide access to this, they can come here in our office and fill up their water bottle. We take full water bottles out to them. It's just become more natural. And even they see us coming and they're like, see, I have water, I'm not drinking soda today.
It's definitely doing what Measure D was proposed to do. It takes a lot of time, and for us being able to receive funding multiple years has been a great asset, because it's not going to change our health outcomes in a day or two. It takes time, and I really do think we'll get there, and we're getting there.